Hey people, it's NIyas713. This is from NBC News. Thousands of service members saying no to COVID vaccine. Some army units are seeing as few as 1/3 agree to the vaccine. Washington, by the thousands, U.S. service members are refusing or putting off the COVID-19 vaccine as frustrated commanders scramble to knock down internet rumors and find the right pitch that will persuade troops to get the shot. Some army units are seeing as few as 1/3 agree to the vaccine. Military leaders searching for answers believe they have identified one potential convincer: an imminent deployment. Navy sailors on ships heading out to sea last week, for example, were choosing to take the shots at rates exceeding 80% to 90%. Air Force Major General Jeff Taliaferro, Vice Director of Operations for the Joint Staff, told Congress on Wednesday that very early data suggests that just up to 2/3 of the service members offered the vaccine have accepted. That's higher than the rate for the general population, which a recent survey by the Kaiser Family Foundation put at roughly 50%. But the significant number of forces declining the vaccine is especially worrisome because troops often live, work, and fight closely together in environments where social distancing and wearing masks at times are difficult. They're fighting with bullets flying at them. Of course, I think being too close to each other is the least of their problems. Well, whatever. The military's resistance also comes as troops are deploying to administer shots at vaccination centers around the country and as leaders look to the American forces to set an example for the nation. So basically, whatever. We're past logic here. It's just do as we say. We're still struggling with what is the messaging and how do we influence people to opt in for the vaccine, said Brigadier General Edward Bailey, the surgeon for the Army Forces Command. He said in some units just 30% have agreed to take the vaccine, while others are between 50 and 70%. Forces Command oversees major Army units encompassing about 750,000 Army Reserve and National Guard soldiers at 15 bases. At Fort Bragg, North Carolina, where several thousand troops are preparing for future deployments, the vaccine acceptance rate is about 60%. Bailey said, "That's not as high as we would hope for frontline personnel," he said. Bailey has heard all the excuses. "I think the most amusing one I heard was the Army always tells me what to do. They gave me a choice, so I said no." Wow. He thinks that thinking for yourself is funny. Oh well. Service leaders have vigorously campaigned for the vaccine. They have held town halls, written messages to the force, distributed scientific data, posted videos, and even put out photos of leaders getting vaccinated. I'll say this, I was once told by a post. I've seen lots of people showing photos of leaders getting vaccinated. I've seen people taking heroin, but it's never made me want to do it. I don't know why they think it will change now. Anyway, let's keep going. For weeks, the Pentagon insisted it did not know how many troops were declining the vaccine. On Wednesday, they provided a few details on their early data. Officials from individual military services, however, said in interviews with the Associated Press that refusal rates vary widely depending on a service member's age, unit, location, deployment, status, and other intangibles. The variations make it harder for leaders to identify which arguments for the vaccine are most persuasive. The Food and Drug Administration has allowed emergency use of the vaccine, so it's voluntary. But department officials say they hope that soon may change. I have a question for people. Is it true that the FDA has not actually tested this thing? I can't imagine so because it's been very, very quick that it's been made. "We cannot make it mandatory yet," Vice Admiral Andrew Lewis said, commander of the Navy's Second Fleet, said last week. "I can tell you we're probably going to make it as mandatory as soon as we can, just like we do the flu vaccine." About 40 Marines gathered recently in a California conference room for an information session for medical staff. One officer who was not authorized to publicly discuss private conversations and spoke on conditions of anonymity said Marines are more comfortable posing questions about the vaccine in smaller groups. This reminds me of an episode of The Simpsons called The Joy of Sect, where to brainwash Homer and others, they just put them in a room and just sort of keep bombarding them over and over and over. And at the end they say, "I love the leader," or "I love the vaccine." Let's keep going. The officer said one Marine, citing a widely circulated false theory, said, "I heard this thing is actually a tracking device." Medical staff said the officer quickly debunked that theory and pointed at the Marine's cell phone, noting that's the effective tracker. That's not debunking. There are tiny things that you can put in vaccines. Loads of small things like nanochips and all these things. They didn't say these things do not exist. That can't happen. They said, well, we already have a tracker. But if you inject a tracker into someone's blood, you can't just leave it at home when you don't want to be followed. Again, I repeat, they did not debunk it. They simply said that they already have a tracker. They didn't say it's not got trackers in it. Other frequent questions revolve around possible side effects or health concerns, including for pregnant women. Army, Navy, and Air Force officials say they hear much the same. The Marine Corps is a relatively small service and troops are generally younger. Similar to the general population, younger service members are more likely to decline or asked to wait. In many cases, military commanders said younger troops say they've had the coronavirus or know others who have had it, and concluded it was not bad. What they're not seeing is that 20-year-olds who've actually gotten very sick, have been hospitalized or die, or the folks who appear to be fine but then turns out they develop pulmonary and cardiac abnormalities, Bailey said. And again, saying this, we don't know the full information behind this. So did they have no prior health conditions and then they got it? Did they have a family history? Again, they always want to say something's happened but without giving any of the background. One ray of hope has been deployments. Lewis, based in Norfolk, Virginia, said last week that sailors on the USS Dwight D. Eisenhower, which is operating in the Atlantic, agreed to get the shot at a rate of about 80%. Sailors on the USS Iwo Jima and Marines in the 24th Marine Expeditionary Unit, who also deploying, had rates of more than 90%. And can I ask you something, the viewer? I know how the Veterans Administration treats people and the healthcare. Like, I heard stories that people would just spontaneously be kicked out of their healthcare, just told it's no longer continuing. No reason that, and the hospitals just don't really take care of people. So an organization like the U.S. military, which treats the healthcare of its service members so poorly after they're no longer useful, and now saying, we really care, we think this is the best thing for you. You know, you just have to have some critical thinking on this. Bailey said the Army is seeing opportunities to reduce the 2-week quarantine period for units deploying to Europe if service members are largely vaccinated and the host nation agrees. U.S. Army Europe may cut the quarantine time to 5 days if 70% of the unit is vaccinated, and that incentive could work, he said. The acceptance number drops off among those who are not deploying, military officials said. General James McConville, the Army's chief of staff, used his own experience to encourage troops to be vaccinated. When they asked me how I felt, I said it was a lot less painful than some of the meetings I go to in the Pentagon. Again, I keep saying, this is not just a one-time thing. This is an experimental procedure, or shot, whatever you want to call it, that has never been tested. It's not like previous vaccines. And the thing is, we don't know what's going to happen 1 year from now, 5 years, 10 years. For all we know, it could cause cancer. We don't know. And I mean, I remember hearing stories, reading about people in the Gulf War who took the anthrax vaccine and them getting all manner of illnesses, like people with crumbling bones. Ugh. Colonel Jody Dugai, commander of the Baines-Jones Army Community Hospital at Fort Polk, Louisiana, said that so far conversations at the squad level with 8 to 10 peers have been successful, and that getting more information helps. Getting more brainwashing and programming helps. At the Joint Readiness Training Center at Fort Polk, Brigadier General David Doyle has a dual challenge. As base commander, he must persuade the nearly 7,500 soldiers on base to get the shot, and he needs to ensure that the thousands of troops that cycle in and out for training exercises are safe. Doyle said the acceptance rate on his base is between 30% and 40%, and most often it's younger troops who decline. You know, in the military, they like younger troops because they're harder to brainwash. Maybe in this case, the younger troops are the ones who haven't been brainwashed, and they're thinking for themselves still, and that's why they're saying no. They tell me they don't have high confidence in the vaccine because they believe it was done too quickly, he said. Top health officials have attested to the safety and effectiveness of the vaccine. Again, a vaccine typically has 5 years of clinical trials. This had 11 months. That does not prove anything. Doyle said it appears peers are often more influential than leaders in persuading troops, a sentiment echoed by Bailey, the Army Forces command surgeon. So basically, it isn't really about showing you that it's safe. It's just about pressuring you with a new peer group that will make you feel stressed enough to take it rather than be the odd one out who doesn't. Anyway, please comment, rate, share, and subscribe. I'm going to leave this article in the description. If you'd like to support this channel, I'll leave my GoFundMe in the description. If you'd like to follow me on Instagram, I'll leave it there as well. If you want to buy one of my t-shirts, I'll leave it there as well. Peace.